I told you that breast cancer can begin preparing itself in the body for years without any symptoms? In reality, certain situations in a woman's life can gradually increase the risk, often without her even knowing it. And let's start with the first one. This one is the most important factor: age. Breast cancer most often appears around the age of 50. Why? Because as the body's cells age, they have more time to accumulate errors in their DNA, and these errors can sometimes transform a normal cell into a cancerous cell, unfortunately. This is why the risk increases, especially after menopause. Secondly, another very important factor concerns hormones, particularly estrogen. Estrogens are hormones that stimulate the growth of breast cells. This is a normal and necessary phenomenon for breast development. However, when breast cells are exposed to estrogens for a very long period of time, these can increase the risk of cancerous transformation. This is why certain situations increase the risk of breast cancer, like early puberty, late menopause, nulliparity or low parity, meaning having no pregnancies or low pregnancy rate, having a late first pregnancy, and the absence of breastfeeding. This is important. In all these situations, the breasts are exposed to estrogens for a greater number of years. Okay? And now let's talk about the third factor, which is hormonal treatments and obesity. Certain hormonal treatments can also play a very important role. For example, long-term menopausal hormone therapy and estrogen progestin contraceptions. It does not mean that all these treatments directly cause cancer, but they may slightly increase the risk of in certain situations. There's also another important factor, which is obesity. Why? Because adipose tissues can produce estrogens. Therefore, an increase in fat tissue can lead to an increase in estrogen levels in the body. And fourthly, genetic factors and family history. When a woman has a family history of breast cancer, especially at a young age, the risk may be higher, unfortunately. Certain genetic mutations are particularly well known, especially mutations in the BRCA1 and BRCA2 genes. Normally, these genes participate in DNA repair and help protect cells against cancer. But when these genes are mutated, unfortunately, this protective mechanism becomes less effective, which increases the risk of breast cancer. 5. Certain abnormalities of breast tissue can also increase the risk of breast cancer. For example, atypical ductal hyperplasia and atypical lobular hyperplasia. These abnormalities are not cancers, but they indicate that the breast cells already show certain changes. These lesions are therefore considered high-risk lesions and require regular medical monitoring. And finally, certain environmental factors. For example, endocrine disruptors, ionizing radiation, certain toxic chemical compounds, and possibly some dietary factors. These exposures are more common in developed countries. Thank you so much for watching till the end, and I hope to see you in the next video. If you find this video helpful, please like it and subscribe to the channel. Goodbye. Have a great day. Bye-bye. Bye.